Sodium is the main extracellular. Its normal concentration in extracellular fluid is 3.5 to 5 milliequivalent per liter. 75% of intracellular potassium is found in skeletal muscle. How does the potassium balance in our body occur? It occurs by input and output. Input daily intake about 2 to 3 gram. 2 to 3 gram, which is equal to 50 to 75 milliequivalent. 2 to 3 gram give us about 50 to 75 milliequivalent اللي هي daily intake. الديلي requirement أيضا تعتبر. الفود rich in potassium include fruits خصوصا مثلا البنانة orange juice كلش rich بالبوتاسيوم. الoutput excess potassium is excreted by healthy kidney عن طريق الكدني. Unlike sodium, kidney has no power to conserve potassium. إذا عندنا هايبوناتريميا الكدني عندها الباور إنه conserve the potassium صوديوم. لأنما على عكس البوتاسيوم إذا اكو هايبوكاليميا الكدني has no power to conserve. ظل تستمر بإفرازها العادي. So sodium loss in the urine even the intake is deficit. فخلينا نحكي على أول نوع من الامبالانس اللي هو الهايبوكاليميا. What are the etiologies of hypokalemia? Loss of GIT fluid. Loss in GIT fluid, for example, in nausea, in vomiting, and after diarrhea, after GIT suction of GIT fluid, after duodenal and intestinal fistula. Also, when there is excessive renal excretion. ليش يصير excessive renal excretion? From the alkalosis. الالكالوسيس يعني بالبلازما يسبب لنا hypokalemia. Why alkalosis cause hypokalemia? Because when there is loss of HCl by vomiting, this will cause a rise in extracellular bicarbonate, which is excreted by the kidney in an attempt to maintain the pH. And large amount of sodium are excreted in the urine with the bicarbonate. And the increasing sodium deficit evoke aldosterone secretion, which in turn result in sodium conservation at the expense of more renal loss of potassium and hydrogen. There will be, after the secretion of aldosterone cause an increased reabsorption of sodium, as we said, from the distal convolute in exchange with the potassium and hydrogen. And this will lead to what we call it urine paradox. What we mean by urine paradox? There is acid urine and plasma alkalosis. Normally, if there is alkalosis in the plasma, the urine should be also, there will be alkalosis. But in this case, after vomiting due to any obstructing agent in the stomach, there will be loss of HCl, will lead to urine paradox. That means plasma عكس اليورين. plasma بها alkalosis, اليورين يكون acidic. Also, another cause of hypokalemia is which cause excessive renal excretion is by giving potassium losing diuretic as a furosemide. Also, another cause of excessive renal excretion that lead to hypokalemia is cortisone and insulin therapy. And also due to adrenal hyperactivity, like Conn's syndrome and Cushing syndrome. Another cause, we said the main cause is loss of GIT fluids. Second is excessive renal excretion. And the third cause is prolonged intravenous administration of potassium-free fluid. أيضا يؤدينا إلى hypokalemia. زين صار عندنا hypokalemia. What are the effects of hypokalemia? Impairment of cellular function. Second, muscular weakness. Hypokalemia raises membrane excitation potential, making nerves and muscle are less excitable. So it causes muscular weakness. Also, there is a risk of supraventricular arrhythmia. When there is potassium depletion, the patients are prone to develop hepatic coma if they have liver disease. Also, metabolic alkalosis, hypokalemia cause metabolic alkalosis. Why? Due to increased excretion of hydrogen ion when the potassium concentration is decreased in renal tubular cells. Also, hypokalemia cause metabolic alkalosis due to movement of hydrogen ion into the cells as a consequence of potassium loss. That means there is intracellular acidosis and extracellular alkalosis. Let us talk now about clinical picture of hypokalemia. Most patients are asymptomatic. Symptomatic patient, the patient is quiet, drowsy, with strong desire to sleep. And also the patient has slurred speech and his speech is slow. Also there is muscle weakness and hypotonia and loss of reflexes. There is also incontinence to urine, which is common occurrence. Rapid shallow gasping respiration, abdominal distension, and paralytic ileus. Also there are cardiac manifestations. There may be cardiac arrhythmias. There is also sensitivity to digitalis medications تاخذونها بالفارماكولوجي act on the heart تستخدم بالارثميا والهارت فيلر اللي هي digitalis. So to increase the heart sensitivity to digitalis. Also there are ECG changes. We may find there is a prolonged QT interval or depressed ST segment or inverted T wave. What is the treatment of hypokalemia? Oral potassium is better whenever is possible, either by tablet or serum of potassium chloride. We calculate the potassium deficit by 4.5 minus serum potassium concentration by 100. Potassium can be added to an infusion and distributed all over the day. يعني ننطيه خلال 24 ساعة هاي الكمية نحسبها. Safe rules for giving potassium. خلي بالك انه البوتاسيوم is a risky medications. يعني لازم انت تطيها with caution and under the supervision of doctor. يعني انت باكر طبيب مقيم لازم بنفسك تعطيه بوتاسيوم. حتى الكادر التمريضي ما مسموح له يعطي البوتاسيوم. ليش؟ لان ريسكي. فالسيف رولز انه الكدني فانكشن از جود. لازم تضمن عندك good kidney function. That means when there is urine output at least 400 ml per hour. ايضا من السيف رولز for giving potassium, the rate of administration should not be more than 40 ml equivalent per hour. ايضا no more than 4 ml equivalent should be added to 1 liter of intravenous fluid. ايضا اشياء لازم تتذكر should never be injected as intravenous bolus. يعني ما ننطي بوتاسيوم مباشرة ابدا. Because hyperkalemia may cause cardiac arrhythmia and asystole. يؤدينا الى راسا اذا اعطيته مباشرة البوتاسيوم يعني مو بالاي في فلويد. لازم نعطي البوتاسيوم بالاي في فلويد through infusion. ابدا ما يصير باللاس دوز لان قد يؤدينا الى ارثميا and asystole. ايضا البوتاسيوم is very irritant to vein فيكوز thrombophlebitis. Now we will talk about hyperkalemia. What are the etiologies of hyperkalemia? After acute renal failure. احنا قلنا the main site of secretion of potassium is through the kidney. So when there is acute renal failure, it will lead to hyperkalemia. Acute. ركز على كلمة acute renal failure. Severe injury. After severe injury and stress catabolic state and sepsis with impaired renal function يؤدينا إلى hyperkalemia. Severe injury, there will be release of high amount of intracellular potassium into circulation. Also after acidosis قلنا احنا الالكالوسيس يؤدينا إلى hypokalemia, الأسيدوسيس يؤدينا إلى hyperkalemia. Over treatment with potassium salt, massive transfusion of warm stored blood. تعرف البوتاسيوم intracellular cation، فإذا كان عندنا دم مخزون لفترة طويلة there will be lysis of RBC، ومن هاي داخل هاي ال RBC there will be release of large amount of potassium. What are the clinical pictures of hyperkalemia? GIT symptom, it may cause nausea, vomiting, intestinal colic, and diarrhea. Cardiovascular signs. First sign to appear in ECG, high peak T wave, wide QRS complex, depressed ST segment, flat P wave. With increased level of potassium, there may be bradycardia, heart block, hypotension, cardiac arrest, and T wave disappears. What are the treatment outlines of hyperkalemia? First, by giving intravenous calcium gluconate. This calcium gluconate antagonizes the effect of potassium on the heart, give a protection to the heart. Also, we give sodium bicarbonate. As we said, the acidosis is one of the causes of hyperkalemia. So, we induce alkalosis, we give sodium bicarbonate, and alkalinization shift potassium intracellular. Also, important step is by giving a glucose with insulin. This will shift the potassium from extracellular to intracellular. Potassium is deposited with glycogen in the cells. And the last step in the treatment is dialysis